Hello everyone, welcome to my YouTube channel. Today in this video, we're going to discuss osteoarthritis, which is a degenerative joint disease. So it can be defined as a degenerative disorder with minimal articular inflammation. Osteoarthritis is by far the most common form of arthritis and is a major cause of pain and disability in older people. As far as the symptoms of osteoarthritis are concerned, it has a characteristic distribution, mainly targeting the hips, knees, proximal interphalangeal and distal interphalangeal joints of the hand, neck, and lumbar spine. Today in this video, we're going to discuss only generalized osteoarthritis. The main presenting symptoms are pain and functional restrictions. Most patients develops pain, stiffness, and swelling of one or more proximal interphalangeal and distal interphalangeal joints of the hands from the age of about 40 years onward. Gradually, these posterolateral swellings on each side of the extensor tendon which slowly enlarge and harden to become hypertons in the distal interphalangeal and Bouchard's and the proximal interphalangeal joint as nodes. Involvement of the first carpometacarpal joint is also common, leading to pain when trying to perform actions like opening bottles, jars, and thus cause functional impairments. The pain in osteoarthritis has certain characteristics. It is insidious, that is, it has an onset of over months or years. It has variable presentation. It can present with intermittent nature. That is, there can be good days and bad days in terms of pain. Also, it mainly relates to movement and weight bearing. That is, it is relieved by rest, which makes it different from the rheumatoid arthritis. There is also mild morning stiffness that is less than 15 minutes, and there is also inactivity gelling that is less than 5 minutes after rest, which also makes it different from the rheumatoid arthritis. Usually it is monoarticular, that is, it is only involve one joint, but sometimes it can involve more than one joint. As far as investigations are concerned regarding osteoarthritis, radiographs can support the clinical diagnosis of osteoarthritis, but they're not routinely required. So diagnosis is mostly clinical. If radiographs are requested, then they can include following findings: narrowing of the joint space, osteophyte formation, and lipping of marginal bone, thickened, dense subchondral bone, and sometimes it can also have bone cyst as well. A good memory mnemonic you can have for all extra features of osteoarthritis is loss, LOSS, that is loss of joint space, osteophytes, subchondral cyst, subchondral sclerosis. So now comes to management of osteoarthritis. So we are only going to discuss it superficially. So it starts with exercise and physiotherapy, and it also involves weight reduction. On the pharmacological aspect, we can start with taking regular paracetamol, and as an add-on therapy, we can add topical steroid as well. If the pain is moderate in intensity that is not relieved by paracetamol, we can go for oral NSAIDs, but we should keep in mind that paracetamol and topical NSAIDs should be considered ahead of the oral NSAIDs. If the pain is so severe that the above cannot relieve it, then we can go with oral opioids such as codeine. But again, you should consider paracetamol and NSAID ahead of oral opioids. At last, if the pain still persists, then the joint surgery remains as the last option. One thing you should keep in mind that people who are at risk of gastric ulcers should not use NSAID unless there's absolutely no better option. If so, then pick celecoxib with the proton pump inhibitor. Otherwise, alternatively pick Cody. So that's it for this video. Thank you for watching. If you have any questions, please feel free to comment for your feedback. Like the video and subscribe to my channel. Once again, thank you for watching.